Namaskar. Hello and welcome to this inaugural session of Diet Doctors. And this is a program which has been brought to you by Rethink India Institute in association with its sister organization, Arogyam Institute of Integrated Medical Sciences. Uh, I am Raghav Mittal, and with me is Dr. Surbhi Vash Mittal, the founder President of Arogyam Institute of Integrated Medical Sciences. Dr. Surbhi Vash Mittal is a graduate from the All India Institute of Medical Sciences, New Delhi. Uh, आरोग्यता की बात आज पूरे विश्व भर में हो रही है एंड द पैराडाइम इज ऑल अबाउट द प्रिवेंटिव प्रोटोकोलाइज्ड एंड इंटीग्रेटेड हेल्थ केयर कि रोग हो ही नहीं कीपिंग द हेल्दी पीपल हेल्दी has become the center stay of public health policy initiatives across the world. भारतवर्ष में इसी विधा को आगे बढ़ाते हुए द ICMR, द इंडियन काउंसिल ऑफ मेडिकल रिसर्च, it has a very eminent institution called National Institute of Nutrition. And just a couple of months back, they came up with a very elaborate dietary guidelines for Indians. It's an updated dietary guideline for the year 2024. And we at Rethink India and Arogyam Institute, we felt like to disseminate the core crux of these 17 odd dietary guidelines, which under the leadership of Dr. Hemlata, ma'am, the whole idea is like as to how these dietary guidelines can go deep into the population. And as Rethink India interfaces phenomenally with the entire academic community, especially at the school level, we felt like curating a program called Diet Doctors. Like the interested faculty members can come forward and master these 17 dietary guidelines into their into their circles of control and circles of influence, because we also run a program parallelly which is health promoting schools. During the COVID era, the World Health Organization came up with the precept of health promoting schools, that schools are the place where the early interventions in healthcare can be easily made, early identification can be done, and a health seeking behavior, that education can be inculcated in the young learners at an early age. So we would be conducting this entire program with Dr. Surbhi in around 18 sessions. Today's inaugural session, we will be talking about the relevance and the spread and expanse of these entire 17 odd guidelines which are out there. And before we do that, we will be taking an entirely academic approach, whereby we will be reading out and trying to disseminate the crux of these ICMR dietary guidelines. It's a public document, it's in the public domain. Our attempt is just to interpret them. Our attempt is just to, I would say, put it in a kind of a friendly language, and our purpose would remain as whosoever would be attending these sessions live or offline later on, they would be getting a gist of these guidelines in an applied manner. Today's session, maybe I would request Dr. So these are the 17 odd guidelines we should be covering in the next 17 sessions, elaborate sessions, and these are action studied guidelines. And what ICMR talks about in its introduction page, because that's where the entire I would say spirit, the raison d'etre, why they came up with these guidelines. That we all know it has been out there that adequate intake of all the essential nutrients through a well formulated balanced diet is actually needed to maintain good health. Nutrition plays a very important role right from the time of baby's presence in the mother's womb till he or she reaches the old age. And a balanced diet prevents all the adverse effects of nutritional deficiencies and also ensures optimal growth and development. It also minimizes the risk of diet related non-communicable diseases, which is abbreviated as DRNCDs, occurring in later life. And sound optimal nutrition status of mother and child during the first 1,000 days of life, starting from the conception till the child completes 2 years of age, is closely linked to growth and learning in the initial stages of development and to the reduced risk of metabolic syndrome, diabetes, and cardiovascular diseases later in life. So here, in the domain of nutrition, healthcare, the domain of learning has come up on its own. For example, the National Education Policy has the 22 cardinal principles, which in another podcast, Rethink India has introduced and called upon the transformational teachers who are adopting them in their individual learning paradigms, in their individual classroom learning stuff. So how this dietary knowledge can be brought over there. And Dr. Surbi, she is a doyen of preventive medicine per se, and she is known to advocate the precept कि आहार ही औषधि है. So perhaps before I take on the further, we move on, I would invite Dr. Surbi to give her opening reactions as to why these ICMR dietary guidelines are so very important, and diet per se as the center stay of health, preventive health, as we can say, keeping the healthy people healthy. So over to Dr. Surbi.
So, namaskar. And first of all, I would really like to, play a lot of emphasis and importance and congratulate and thank ICMR for introducing these dietary guidelines. ICMR, the Nutrition, Institute, to introduce these dietary guidelines because, as we see various cases, medical cases, and day-to-day lives, even keeping healthy people healthy, diet is something which is most neglected and paid least emphasis to in our fast-paced lives. And to sum it all, to start with the summum bonum, diet is the center stay of good health. A good balanced diet is a center stay of good health. When we talk of diet, we talk of quantity, quality, timeliness, and various aspects which lead to a healthy body, a healthy mind, and that's how we get a healthy body, a healthy mind, and a healthy soul. So, dietary guidelines for Indians, the ICMR dietary guidelines, this is a really important step. And Ahar hi aushadhi hai. We strongly believe this at Arogyam Institute of Integrated Medical Sciences. When we say integrated, any treatment which is implemented at any of the levels, there is a dietary advice. In my pedagogy, in my practice of treatment, pedagogy as in when we educate the patient about how to administer the treatment, we talk about diet. In fact, nowadays in corporate hospitals and healthcare delivery per se, dietitians and dietary educators have assumed a very important role because of the increased awareness pertaining to diet. This is a very good development. And I think that the ICMR dietary guidelines, this step to educate our faculty members, because every guru or faculty, is interacting with so many students, so many families. So if they are armed, if they are the diet doctors, I'm sure it would have a pervasive and a deep impact on the society and the health, overall health of the society.
Thank you, Dr. Surbia. And as it is said as the motto of the All India Institute of Medical Sciences, that Sharir Madhyam Khalu Dharma Sadhanam. So every dharma, whatever has to be fulfilled, the Sharir, the body, a healthy body can only inhabit a healthy mind. And that's where the entire process of education per se, as has been mentioned so very spectacularly in this introductory note of the ICMR dietary guidelines for Indians, has meted out. So, appropriate dietary habits and physical activity through all the stages of one's life are so very essential for the maintenance of holistic health. So, this is not coming perhaps in this age of reason. Not coming from our nannies and daddies or our fathers or our well wishers in the family, but it is coming from one of the most authentic seat of Indian medical research. And perhaps that's where we, the intellectual mind of today, would really pay heed to the advice, I would say, to the guidelines and to the injunctions which have been so very painstakingly collected out here. This is all a primer. We are just rushing it through, but for the sake of completeness, a balanced diet fulfills all the nutritional needs of the body. There is no single food which can provide all the necessary nutrients, and hence these need to be obtained through a judicious choice of a variety of foods. Here, I would like to just put upon a editorial commentary that these days, in the age of super specialization, we feel, why is the need for us? I am a specialist in my own domain, own subject. Why should I get into the domain of diets? There are a lot of dietitians around the market. Any hospital you go, any place you go, a lot of dietitians are available. But as they say that this is an age of interdisciplinarity as well. A subject matter expert has to have a major focus and then minor specializations in a whole lot of things. And diet is something, nutrition is something where I think every educator should have some inroads, some orientation towards. And there is no harm, because it's a ever evolving field, and really getting a hang of these dietary guidelines would really empower us to actually adopt these healthy practices in our own personal lives, in our zone of controls, our classrooms, and in our zone of larger influence wherever we go. So that's the whole purpose behind this program which Rethink India Institute has come along with Arogyam Institute of Integrated Medical Sciences. And so a judicious choice of a variety of foods has to be ascertained, and a lot of technical data is out there. And thankfully, we have Dr. Surbi, who is an expert in the medical space, and she will be guiding us further into the nuts and bolts of the measurements, the impact, a kind of a balanced application of these 70 dietary guidelines into our day-to-day lives. And as a part of this program, we would like to really recognize those who would undertake a deeper certification program as diet doctors, a kind of a very specialized certification just to promote, just to motivate our faculty members across the nook and cranny of the country. So such diets also provide a host of other bioactive substances and phytonutrients, and thus exert a positive impact on health. I would like to bring in Dr. Surbi as to what are bioactive substances and phytonutrients. Perhaps a kind of a technological understanding would help us understand better.
So, for example, green leafy vegetables. So, the nutrients which we're getting from the natural sources, phytonutrients are the nutrients which are there essentially in the natural green leafy vegetables. For example, we have oil seeds, and so bioactive substances are those which are, they might be in a form when we've extracted them from the plant, but the nutrient, the nutritional activity is at the highest. So that is one
So
interpretation
it
of
is
this.
it is differentiated from the chemical or the pharmaceutical active
Yes.
substances, perhaps. Mhm.
Absolutely.
Thank you. Thank you. So, appropriate dietary habits, they promote optimal growth and development and prevent malnutrition occurring in all its forms. Malnutrition forms happen like undernutrition, micronutrient deficiencies, overweight, obesity, which also includes abdominal and central obesity, and DRNCDs, as we just learned. They are non communicable diet related non-communicable diseases. So for the ease of understanding, it would be appropriate to talk in terms of foods and food groups. This is a departure which this ICMR guideline has come through. They will be talking all about food and food groups instead of specific nutrients. That becomes too technical. Somewhere or the other, the approach of the entire team at ICMR NIN was to make it available to the end mass, to the last person in the queue, as they call it, for an easy understanding and deployment. So the guidelines focus on food-based approach for attaining optimal nutrition and represent the recommended amounts of nutrients that should be consumed through food. So food-related approaches are presented in both qualitative and quantitative terms. Emphasis across these guidelines have been laid on the recommendations which can maximize protective effects in accordance with traditional habits. So traditions have not been done away with. They are the foundations of it all, where the modern scientific language has been overlaid out there. The guidelines have taken into consideration food groups and food items derived from common Indian diets, such as whole grains, pulses, milk, vegetables, and fruits to facilitate diet related decision making. Now, this is a very, very vital aspect, diet related decision making, which has to happen at every household and even at the seat of education where we are directing this program towards. So, in order to capture the diverse cultural, culinary practices and food groups that exist in the country, we all know that India's culinary heritage is one of the most enriched one across the globe. And overlaying the dietary considerations, and somewhere or the other we will find all through these 17 ICMR guidelines that a lot of our traditional wisdom has been brought about. The scientific evidences and the scientific rationale would come automatically once we will devour through each one of these guidelines and master them. Various kinds of cereals and millets are used as staple foods in the country alongside a variety of pulses. So, all those foods which are accessible and most importantly affordable. At times, it happens that, oh, healthy food is what is a healthy food? Is it the big shot organic food shops or brainy food shops which have come, the fancy ones? So, it has to be affordable on the pocket as well, by the common man have been recommended by the for the formulation of healthy diets in these guidelines. And the 17 dietary guidelines place firm emphasis on health promotion and disease prevention across all age groups, with special attention to the nutritionally vulnerable segments like infants, children, adolescents, pregnant and lactating women, and the elderly. The key points pertaining to each of the guidelines which have been discussed have been included at the each of chapters, and we will be devouring, we will be explaining them as the sessions progress. And they also underscore the role of other related factors. Diet is not just alone, it works in tandem with physical activity, healthcare, safe water supply, environmental sanitation, personal hygiene, and other socioeconomic factors which generally impact nutrition and health outcomes. So this is where I would say that the word integrated health, integral health, what Dr. Surbi just mentioned about, this is one just dimension of that integral health. And the use of dietary guidelines might require an adaptation to socio-economic, agricultural, and other environmental conditions. And that's why we've invited the faculty at the school level who are empowered enough to really ascertain, undergo research and adaptation so that they can deploy, they can help the deployment of these dietary guidelines into their circles of control and influence per se. And the guidelines contain in them the scientific evidence based information that would facilitate the attainment of the goals stated in the national nutrition policy. It has been condemned by some of the global ranking indicators as if our hunger index, our nutrition index are way apart. Perhaps this is perhaps a great attempt by ICMR to bring to the Western eye that look, we too have a very profound precept of nutrition, which is a scientific base somewhere or the other, because we have been treading a civilizational pursuit. We never thought of documenting them or bringing them to the limelight, trumpeting about the science behind. But then perhaps in this scientific era, in this where the civilizations are under clash, the ways of life are deterring. So perhaps this is a great attempt to bring to the fore the profound scientific wisdom of our Indic knowledge systems. And the guidelines are also consistent with the goals set in the national policies on agriculture and health, a kind of an integral policy, we can say so. And these guidelines are meant for the benefits of the general population and for the practicing nutritionists, dietitians, health professionals, and other stakeholders. We don't claim that this is an advanced kind of a thing, but then a basic baseline understanding, a baseline devouring of these 17 dietary guidelines perhaps is meant for one and all, anyone who is educated to a decent level, because food is something which we all consume, and it's all about personal health. So apart from the professionals, this guideline, this program is for the general population, and we at Rethink India have thought to direct it at the level of school faculty members. And this is the operating part which actually inspired us to undergo this program, that the translation of this knowledge into action. It calls for the coordinated efforts of several government and non-governmental organizations as well as the academic world. The dietary guidelines need to be widely disseminated among the masses through effective information, education, and communication strategies and other large scale behavior change communication campaigns for improving the knowledge, attitudes, and practices of all these stakeholders. And perhaps ours is a very humble endeavor towards this stated goal by the ICMR learned team at NIN. So I would now like to switch on to more technical aspect in today's inaugural section. What is the need? What is the current diet and nutritional scenario which actually constitutes the foundation of these ICMR and IN dietary guidelines for India? They have put a very, very specific term. They could have done it at a global level, but they were very true in their profound wisdom to put it in the context of Indians, because every culture, every geocultural locale has its own culinary preference. So that's where this entire guideline is all about. So in India, severe forms of undernutrition, such as marasmus, kwashiorkor, and keratomalacia, they have largely disappeared. At the we all know our colonial subjugation in 100 years, 20 odd famines this country had to face. This is a part of the checkered history of British colonial imperialism. And at the start of independence, we also had a glut of food grains. India is now surplus in food supplies for that matter. So, to a great extent, we have marched forward in our sovereign independent journey as a glorious nation in the committee of countries out there. So, but subclinical manifestations of undernutrition and anemia, they persist as public health issues. Perhaps I would bring in Dr. Surbhi because she faces this anemic issues regularly with her patients and all. A quick comment on this aspect per se.
So, anemia, is of course very, very rampant and found so much in the population. And anemia, is deficiency of hemoglobin, and It may be due to various reasons: iron deficiency anemia, pernicious anemia, which may be due to deficiency of vitamin B12 complex, and so on and so forth. These are nutritional deficiencies. And believe or not, even pregnant women are suffering from anemia in our rural India. Even in the urban segment, some of the anemia in elderly population goes unnoticed. And anemia has so many manifestations, wherein you have palpitations in the heart, weakness, drowsiness, nutritional deficiencies largely. Again, when we talk of children, the pediatric population, children also, due to non-focus of healthy food substances, consuming junk foods, the overall nutritional balance, and sometimes, some kind of nutritional deficiencies and imbalances are also noted, like vitamin D deficiency and so on and so forth.
Thank you, Dr. Subi. And significant proportion of children, they suffer impaired nutrition status, as Dr. Surbi just mentioned. And concurrently, there is a rising prevalence of overweight and obesity in several states, creating a dual burden of malnutrition, where both undernutrition and overweight and obesity, they coexist within the same communities, and even within households. And
As I
these are
said
the
earlier, that the children, for particularly, well, there's a common term which we say as couch potatoes.
Hmm.
So watching television on the sofa for long hours, prolonged hours, eating, Lay's chips and and taking Coke and, Fanta and cold drinks. All these are typical, invitations to the classical syndrome of, undernutrition, in the sense of nutritional imbalances where deficiencies are there, and obesity, wherein you're consuming so much of junk food. So this is all coming from lifestyle practices in the same household.
So just see this, this table is quite instructive, and you like to unravel, spend some time on this table, which is based on CNNS 2019, just 5 years back, and this is Comprehensive National Nutrition Survey. And if you can see that it is all about the nutrition status and serum biomarkers of children aged 1 to 19 years. And if we can see, this is the category, these are the age groups: 1 to 4 years, 5 to 9, and 10 to 19. Anemia percentage in the population which was surveyed: 40% of the kids in the age group of 1 to 4, they had an anemic condition. In the age group of 5 to 9, it was 23.5, and 28.4 in the age group of 10 to 19. So anemia is, it remains a very important undernutrition status out there. The micronutrient deficiencies, the term micronutrition came. Now, what are those micronutrients which perhaps when you go to a doctor formally, he or she prescribes a lot of tests? Sometimes we don't understand what they are trying to gauge, but perhaps they try to ascertain the status of many of these health parameters to come to a prescriptory diagnosis, and they give you a lot of counseling apart from the medicines over the shop. अगर कोई अच्छा डॉक्टर है, if you go to them, कहेंगे भाई अच्छा खाओ. A lot of counseling actually goes into, and perhaps Dr. Surbi's practices have seen more 50% or more, and the doyens from Insonians whom we have the great fortune of learning from, they're perhaps 50% or more. It's on the counseling part, the dietary part of it all. And as they say in the quad, ahar, vihar, vichar, and aushadhi. Uh, that this is the quad of arogyata. Ahar is the diet we are all talking about. Then vihar, our lifestyle, our sleeping patterns, our physical activity, that all comes in the vihar part of it. And then vichar, psychosomatic, there is a term called PIN, psychoimmuno neuro. A lot of disease burden is because of that vichar part of it all. We are overthinking, we are in anxiety, we are in depression. So how the vichar part of it all, and it, the balance of disbalance of these three, aushadhi just comes as a last resort just to help it across. So iron deficiency percentage, as we can see, it is also quite substantive in the infant, the nutrition vulnerable age. It is higher than folate deficiency, quite substantive. And folate deficiency, as we can see, it goes high in the 10 to 19 age group. Then vitamin B12 deficiency. Again, it is quite high in the 10 to 19 age group when the children reach at a age of understanding. Perhaps this is where perhaps the unhealthy diets, the ultra processed foods, and all that stuff comes into play. Vitamin A deficiency, it's quite spread out, but then 5 to 9 age group. 25 hydroxy vitamin D, then zinc deficiency. These are all the micronutrients we'll be all talking about as a part of the food groups. Which food groups? Because this is a highly technical domain at the elemental level, but at the food group, food level basis, how we can have a balanced diet will be coming as a part of the next sessions. And then, as we learned a term of diet related non communicable diseases, overweight percentage, we can see obesity, pre-diabetes, 10.3 and 10.4, quite high in the 5 to 9 and 10 to 19 group. Diabetes, it's still quite low in the Indian population, but it's a point of concern. In the pre-diabetes to diabetes level, the transition might not be, it might not take much of a time, perhaps. Then elevated HbA1c. This is again a kind of a parameter which when you go to a doctor, they test you 3 months accumulated kind of a uh, metric which shows that what is our diabetes status. We will not go into much of the technicality, medical technicality, because this is for a general population. Then high triglycerides, as we can say, in the 5 to 9 age group, it is quite high, 34%. So this table shows a kind of a spread that because of the unhealthy or malnutrition and as they say double whammy, that undernutrition and overweight or obesity, how to balance it all through. Now, what I'm going to say, what I'm going to read out, the last this statement, this is going to strike us phenomenally. That 56.4, close to 57% of the total disease burden in India is due to unhealthy diets. So I think we really deploy these 17 dietary guidelines into our daily life. I think 57%, close to 57%, 56 भी मान लें हम, 56% of the disease burden would really go off. And healthy diets and physical activity can reduce a substantial proportion of coronary heart disease and hypertension and prevent up to 80% of type 2 disease, diabetes which is increasing like a pandemic in the country. 80% of it, of type 2 diabetes, which we all incur in our households, can be prevented. A significant proportion of premature deaths can be averted by following a healthy lifestyle. Now, this is not something a senior in the family is saying. This is coming from the authority of ICMR NIN. And the data from the Comprehensive National Nutrition Survey, it highlights that substantial number of children, they exhibit early indications of non-communicable diseases and its related risk factors like diabetes and hypertension. And that's where this Diet Doctors program directed at the school faculty makes all the difference, because teachers have a huge influence on their kids. So apart from teaching them the multitudes of subjects, if they can incorporate whatsoever faculty specialization you are in, you can be a diet doctor. You can be an influencer on the young toddlers who are in your classrooms. And because in a healthy body, a healthy mind, a healthy learner can only stay. So the presence of altered metabolic biomarkers over half of the undernourished and normal weight children and adolescents, it raises a significant public health concern. So table 2, I will just show that nutritional status or NCDs, men, women, 20, these are undernutrition, overweight, obesity, hypertension and diabetes in the 18 to 69 year adults in India. as per the National Family Health Survey 2021, the numbers are uh, quite striking. Abdominal obesity 55.5, 47.7. Women have a much higher percentage, 63.5 and 56.7. So, chronic energy deficiency or undernutrition amongst adults. So, if the healthy habits are impregnated, inculcated in the young toddlers, वो जो कहते हैं ना शिक्षा के साथ हेल्दी हैबिट्स को संस्कारित कर देना, इम्प्रेग्नेट कर देना, एंड दैट्स वेयर अ हेल्दी नेशन, a विकसित भारत will be a healthy Bharat as well, because only when the healthy adults would be supercharging the economic space, then only a country would be, it will be competing in the Committee of Nations. And so this is where these seeds of healthy behavior, they have to be sown. So furthermore, the upsurge in the consumption of highly processed foods laden with sugars and fats, coupled with reduced physical activity and the limited access to diverse foods, exacerbate micronutrient deficiencies and the overweight, obesity problems. So, in fact, some of the scholars are of the opinion that, like the way we put up statutory warnings on the cigarette tobacco packs, perhaps it's time to put up similar such health warnings on these kind of highly processed foods and with heavy sugars and fats, because they're spreading like epidemic in our today's society. And research has indicated that unhealthy, highly processed, high fat, sugar and salt, which has been termed as HFSS, these foods have become more affordable and accessible than the healthier alternatives. Now, this is the reason why this is all spreading out, and aggressive advertising and marketing of these unhealthy foods through different media channels, including social media, they are seen to influence dietary preferences among both children and adults, leading to detrimental long term effects. The regulators, the government, the industry, it might take a longer time to come to terms to this. The governments had to fight a long battle with the tobacco industry before the statutory warnings were to be imposed on the packs over there. So it is the role of the academia, perhaps. It's the role of these schools where we are nurturing our young minds to get educated about the evil effects of the HFSS foods which are being imposed upon them by the larger advertising instruments in a very attractive fashion. So once the kids are empowered enough through the power of knowledge, I think they will adopt healthy diet regime over there. A large chunk of family income is spent on buying such unhealthy foods. We would like to request our course takers, our program attend, to conduct a survey with the students, that let them go back home and spot out these HFSS foods and the kind of money, the kind of monthly budget their mother, father, they all spend going to the nearby shopping mall or online purchases. So, what quantum of the food is actually junk food, as we call about it? So, these are the kind of eye openers which will be trying, which will be helping you as a part of this program. So, this faulty dietary pattern contributes to deficiencies in iron and folic acid, the micronutrients we all talked about it, resulting in anemia and in the higher prevalence of overweight and obesity among population groups. So, addressing the issue of anemia necessitates the adoption of the practices of dietary diversification among people and undertaking of measures to counter non nutritional contributors Placing emphasis on eating a variety of foods also aids in tackling the problem of overweight and obesity. So this is a very vital aspect कि केवल आलू ही खा रहे हैं. In fact, I would like to bring in Dr. Surbi about this diversity of nutritional diets, why it is so very important. Just an expert's opinion out there.
So, in diets, it is scientifically proven, and it is, as ICMR has also mentioned this so emphatically, that a diverse diet consisting of multiple nutrients and micronutrients adds to the nutritional value of the food consumed. It is also said that certain food items help in the absorption of the other nutrients. This is one point. For example, if we are consuming pulses like dals, it is said that if you add a bit of lemon juice to the dal, the protein content of the dal is absorbed, the pulses is absorbed better. Similarly, it is said that vitamin D helps in the action of insulin in the body. Now, where you're getting vitamin D from? Well, primary source is sunlight, of course. But then, these are the interplay of nutrients. Similarly, so when we say that when we are consuming diverse food items, the nutritional overall health is better. Also, consuming, say, as you mentioned, aloo or potatoes, when you are consuming aloo and potatoes only, you are consuming only carbohydrate or starch, what aloo is containing, and it is a very high rich source of carbohydrate. It is not advisable in diabetes especially, and if you are depriving yourself of all the accompaniments of the aloo, if you're not taking, the green leafy vegetables, the legumes, the other vegetables which could have added to the nutritional value, that is being deprived of one, and aloo is getting deposited, the potato is getting deposited. So as we say that if one element only is being consumed, one nutrient is being consumed, one it tends to get deposited in the body. Like also we say it with cooking oils, consuming a variety of oils, it doesn't let the fat deposition happen. So this is a scientific fact, I mean, which ICMR has brought about very well, that variety of food items adds to the nutritional value. So at the same time, however, we need to be careful of what food items to choose. This is also there. So, for example, we say that consuming, for example, tea has, which we say chai, immediately after 1 hour after meals, it would reduce the absorption of certain nutrients in the diet overall. So tea should not be consumed immediately 1 hour after the meals. For example, calcium and other nutrients are absorbed lesser, if tea is taken. So the right choice of the food items has to be there. But yes, diverse food items helps the nutritional value, enhancing the overall nutritional strength of the food.
So perhaps most of what Dr. Surbi said uh, is in our families, traditional families do have this
True.
wisdom. But perhaps ICMR has, for the first time, converted this all into a scientific evidence so that we
Yes.
have more faith and we have more belief. And then we can advance further based on the scientific evidence, whatever we are getting out there. So the ICMR NIN, my plate for the day, recommends sourcing of macronutrients and micronutrients from a minimum of 8 food groups with vegetables, fruits, green leafy vegetables, roots, and tubers forming essentially half the plate of the recommended foods per day. The other major portion is occupied by cereals and millets. So followed by pulses, flesh foods, eggs if you are non-vegetarians, nuts, oil seeds, and milk or curd. So that constitutes the 8 branched octet of the pie of the food plate out there. So intake of cereals, largely it should be limited to 45% of the total energy, while for pulses, eggs, and flesh foods, the total energy percentage should be around 14 to 15%. Total fat intake should be less than or equal to 30%, energy, while nuts, oil seeds, milk and milk products, they should contribute to 8 to 10% of total energy per day respectively. So it looks like more of a recipe, more of a technical chemistry lab or a food lab, we can say so. But then in practice, in our traditional families, if we say, there are ways and means as to how this scientific wisdom is distilled into action. And as a part of this program, and we'll be going to the various guidelines, ICMR has also come in its annexures as to how to convert this scientific numerical stuff into real actionable, how we can really practice it in our daily kitchens, so and so forth. So, however, as per the data, cereals they contribute 50 to 70% of total energy per day. Pulses, meat, poultry, and fish together contribute to 6 to 9% of the total energy per day, as against the recommended intake level of 14% of total energy from these foods. So there is a slight variation which has to be adjusted some way or the other. So in a large segment of the country's population, the intake of micronutrient dense foods like whole grains, pulses, beans, nuts, fresh vegetables, fruits is found to be lower than the recommended levels. Somehow or the other, there have been historical reasons for it, per se, things like that. And whereas the intake of refined cereals is found to be higher, a steady increase in the intake of unhealthy foods among people complicates the matter further. As a result, majority of the population, including children, they suffer from malnutrition and its adverse health outcomes. So this is not just a heuristic. This is based on firm data with ICMR at a population level, and that's where they are concerned, and they want to give us these guidelines so that we can practice them in our day-to-day lives. So while overall food grain production, especially of cereals, has risen consistently over the past few decades, the per capita availability of food grains indicates adequacy in cereals, with pulses remaining low. So there have been economic reasons for that. India had to go for a green revolution because we were on the verge of not having enough food grains. So economic reasons still persist. 80 crore plus of our population is dependent on governmental rations, the free rations per se. So government has its own limitations in providing a holistic meal, but at least in the segments where this program, especially in a bit more, I would say, prosperous areas, a balanced diet can be attained over there. So, the most logical, sustainable, and long term solution to all forms of malnutrition is ensuring the availability, accessibility, and affordability of nutrient rich foods while promoting consumption of diverse foods from various food groups. So this is the central message what ICMR is giving to us. And dietary guidelines, they play a pivotal role in guiding uh, individuals towards selecting appropriate foods in adequate quantities across a range of food groups, thereby facilitating optimal nutrition throughout the lifetime. So these were the two introductory remarks, the current diet and nutrition scenario, and introduction part of it. And on the basis of it, ICMR has curated this set of 17 guidelines for Indians, and we would just as a part of this inaugural session want to read them out just to give you an exposure as to what lies in the 17 consequent sessions of this program. And they are very, very diverse as they are talking about diverse foods or so. So first and the foremost guideline they have given, the first mantra, like the 22 NEP guidelines, what they have given is that eat a variety of foods to ensure a balanced diet. This is the first and the foremost principle. The next three or four three guidelines are related to the pregnant and the lactating women, because that's from where our body comes in. It's more from uh, a living being's genesis that ensure provision of extra food and healthcare during pregnancy and lactation. So the first 1,000 days are so very vital for any living being's health. So pregnant mother has to be given enough food, then ensure exclusive breastfeeding for the first 6 months and continue breastfeeding till 2 years and beyond. So this is something more on the obs and gynac on that frontier, but then ICMR had to be more comprehensive. And perhaps if these guidelines come into the educational space, it's not just the purview of, I would say, your gynac or an obs and gynac physician, also should be a part of the common knowledge, further reinforcing that. And the fourth guideline is start feeding homemade semi-solid complementary foods to the infant soon after 6 months of age. So we very very elaborate guidelines. If we see the guideline 2 ranges from 13 to 21, like around 6 to 7 pages. Eat a variety of foods to ensure balanced diet is again a 12-pager long guideline, and we will be devouring them in depth in consequent sessions. Guideline 5 is all about ensuring adequate and appropriate diets for children and adolescents, both in health and sickness. आप किसी भी डॉक्टर के पास जाइए, इनफैक्ट डॉक्टर सुरभि, इन योर एक्सपीरियंस, अच्छा खाना खाइए, ये हर डॉक्टर क्यों कहता है? अगेन एम्फेसिस ऑन आहार ही औषधि है प्रिसेप्ट.
See, fundamentally, immunity, when we talk of immunity, immunity is something which is, built inherently in the body. And where does immunity come from? It comes from ahar, it comes from the food you take and how the food is prepared, the science of, preparing the food, how you're consuming, what time you're consuming. So, again, all these are a part of the dietary guidelines. It's very important to develop immunity if you want to prevent disease. Lifestyle, food habits, food practices, what food you're consuming, all this becomes extremely important. And then when we say that we want good health, so good health and a sound body and a sound mind, ahar, vihar and vichar, औषधि की जरूरत ही ना पड़े.
Thank you, lovely. The guideline 6 again, eat plenty of vegetables and legumes. Very elaborate discussion ICMR has brought about. Sabziyan, legumes, eat more and more. Then seventh guideline is all about use oils and fats in moderation. Choose a variety of oil seeds, nuts, nutri cereals, and legumes to meet daily needs of fats and essentially fatty acids. So while they are talking about diversity of foods, they are also talking about moderation. Plenty of vegetables and legumes is prescribed, but then oils or fats, they have to be used in moderation. So it's like a sargam, the food balance, the raga of a healthy diet. That's what ICMR guidelines are trying to promulgate to all of us. Then guideline 8 is all about obtain good quality proteins and essential amino acids through appropriate combinations of foods and avoiding protein supplements to build muscle mass. Now, this will be a contentious issue because today, over the counter protein mass is being distributed just like candy cakes, and the young adolescents, we are all going to the gyms, and kind of misnomers are out there about protein. So I think these are the guidelines which are helping us in the most authentic and authoritative fashion कि भैया क्या करना है क्या नहीं करना है. And our diet doctors would be enrolling into this program and devouring and championing each one of these dietary guidelines empirically. They will be championing that in a numerical fashion as well. They will be able to counsel their circles of influence, circles of control about all these aspects. Then guideline 9 is more about prescriptory, that adopting a healthy lifestyle to prevent abdominal obesity, overweight, and overall obesity. So they have a lot of prescriptions in around 7 pages over there. Then being physically active and exercising regularly to maintain good health. So this is not just a single term. A whole prescription in around 4 or 5 pages is given. Salt intake. So a lot of talk like restricting salt intake, how to measure it, which kind of salt. So very technical depth they have gone over there. Then consuming safe and clean foods. Safe and clean are the two operating words out here. We would be covering them in the guideline 12 session. And adopting appropriate pre-cooking and cooking methods. So again, they come to the kitchen, how to pre-cook and cook the various food items. So again, a very comprehensive set they have put up. Then, while they say that restrict salt intake, they have said about drink adequate quantity of water, and the entire, and it's quite in 4 to 5 pages. They have gone to greater depths. Then minimizing the consumption of high fat, sugar, salt, and ultra processed foods, which is hampering our health in a phenomenal fashion. And then the 16th guideline would be all about include nutrient rich foods in the diets of the elderly for health and wellness. So they started with the infants and up to the elderly. The entire life cycle has been covered. So how we should treat our elders in our family so that their geriatric stage, they can jivem shardha shatam, the ideal, ki let we live for 100 years, has been the Indian ideal largely. And finally, read information on food labels to make informed and healthy food choices. A lot of packaging comes into play, a lot of stuff we all devour, but without reading deeply. So that's where ICMR is giving us the mantra, the talisman. कुछ भी खाओ, packaged food को पढ़ तो लो. That's where your learning will come into action. So then they have some four annexures, suggested measuring of katoris or cups and spoons, raw food items measures using household utensils, glycemic indexes. This is very important. A lot of we in the regular family you might have heard iska glycemic index high hai, kam hai, zyada hai. Then various food categories under different food groups. We'll try to cover all these four annexures as a integral part of these 17 guidelines itself. And the whole idea is to create a kind of a general guideline and touching upon a bit of specialization and general interest on diet. Because as Hippocrates wrote in 460 BC, that let food be thy medicine and medicine be thy food. Ahar hi aushadhi hai. And we all know that all the modern doctors, they take the Hippocratic oath, and it is this his adage. And coming back to the Indic tradition, where Ayurveda had been in so much of vogue, and again Ayurveda is picking up that when diet is wrong, medicine is of no use, and when diet is correct, medicine is of no need. So I think with this we will close this inaugural session with, I think, closing words, closing remarks from the expert who would be taking us through, helping us interpret these intense ICMR guidelines, Dr. Surbi, to sum it up, and then we will wrap up today's inaugural session.
So, to conclude, we would say that this is the end of a small begin of a great beginning, and we have just covered the introductory session about the ICMR dietary guidelines and enumerated the 17 salient points of these dietary guidelines, which would be further elaborated in detailed chapters. So, the diet doctor, essentially, which we at Rethink India want to aim at is creating, the sentinels of health. They are the custodians, the sentinels of health. They are armed with all the dietary knowledge. And, as we say, ahar hi aushadhi hai. So we should get the fundamental tenets right in place. And for Sharir Madhyam Khalu Dharma Sadhanam, for a sound mind and a sound body, for the dharma to happen, you need ahar at the right time with the right food items. And believe you me, कहते हैं that अच्छा भोजन जो है वो तो मुर्दे में भी जान फूंक देता है, देवताओं को भी प्रसन्न है कर देता है. So food is a very important aspect from the tattva drishti as well. वो कहते हैं जैसा खाए अन्न वैसा होए मन, जैसा पिए पानी वैसी होए वाणी. So scientific principles deployed in the ICMR guidelines, these are something which are all our community should follow and implement in our daily life practices. With this prayer and a wish, I think I would like to thank all our listeners and audience to have to embark on this journey with us and implement this in your dietary food practices.
And as a part of our differentiated way of delivering this program, we will be picking up from the reverse. We'll be picking up the guidelines 17 first, and then we will go on to guidelines 16, then 15, then 14. Because for the kids, for the young diet doctors, it looks very interesting how to read a food label and to make informed and healthy food choices. These are more applied and involved ones. The first three or four are more in the domain of doctors for the pregnant and lactating mothers. We will be covering them also, but then just to create a popular interest amongst our audience, we'll be taking up these sessions in a reverse order just to create a popular interest with that. We'll be back with the next session. So stay tuned on this series, and if you have any questions or queries, you can contact us at Rethink India. You have all the numbers and email IDs. Editor at rethinkindia.in is the email ID onto which you can send your comments and suggestions, or you can also put up in the comment section of the YouTube video where you will find this introductory session. So thank you so much. We'll be back again and we'll be completing this 18 session series